Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the basics of disc bulges and disc herniations. When you look at a normal intervertebral disc, it's composed of 80% water and 20% collagens and proteins. There are two areas, and the best analogy is that of a jelly donut. So the harder outer part of the donut is the annulus fibrosus, and the inner gelatinous part is the nucleus pulposus. Okay, there's no nerve endings here. The annulus does have nerve endings, so it can feel pain. The disc itself is a great shock absorber. As we walk, run, jump, twist, bend, flex, all that, water comes out and then water comes right back in. Disc degeneration occurs commonly between the ages of 20s to 50s. A number of risk factors including obesity, smoking, repetitive trauma, such as being a truck driver or something repetitive like that. There's a genetic factor, and there's also some social and environmental factors. What this can lead to is loss of fluid in the discs and subsequent loss of height, and then some tears or cracks in the annulus and potential for back pain. So here you see a healthy disc from the side, and then you start to lose height from loss of water, and it can bulge out like a tire that's getting flat. Okay? Now, the loss of water, as I mentioned, is like losing air from a tire. 35% of those between the ages of 20 and 40 have evidence on MRI of degenerative disc disease and no pain whatsoever. Okay, so it's important to understand that a lot of disc bulges and degeneration cause no pain whatsoever. Okay, so when you sit there and see this on an MRI, it can't just be an incidental finding, or it could be the source of daily chronic disabling pain. Now, disc herniation goes a little bit of a step further. So here you have a normal looking disc with the inner gelatinous part and the outer annulus. Okay, then you have a disc bulge where part of the disc is bulging out. Here you actually have a disc herniation where there's a tear here and the inner jelly squeezes out and pushes on this nerve root. Alright, and then here you can actually have an extruded disc fragment where this piece separates and it gets stuck there. A herniated disc is also called a slip disc, herniated nucleus pulposus, prolapsed intervertebral disc. They all mean the same thing. Now, the symptoms are going to vary. Most disc bulges, as mentioned, don't cause any pain at all. Or a disc bulge may cause back pain. It can also cause sciatica pain if there's inflammation in the area and it hurts a nerve root. It can lead to spasms and aching. Disc herniation symptoms may include a burning, searing pain, a sensation of pins and needles or numbness. It can develop into some motor weakness, and very rarely you can get incontinence. That's called cauda equina syndrome. That's a surgical emergency. Treatment of disc bulges and herniations, if it's not that bad of a pain, the answer is benign neglect, meaning you know it's there, you're going to just follow it, but you're not going to actively treat it. Over-the-counter medications may help, including anti-inflammatories and Tylenol. Physical therapy and chiropractic treatment can be beneficial. This may include modalities as well, such as electrical stimulation, ultrasound. A TENS unit might be helpful. There's a treatment called spinal decompression therapy, which is an FDA-cleared computerized intermittent traction. It's been shown to be very beneficial for both disc bulges and symptomatic herniations. Prescription medications may include a Medrol dose pack, which is a burst of prednisone that tapers off for a few to 5 days. Narcotics may be helpful. Non-narcotic medications such as tramadol, muscle relaxers, neuropathic medications. We don't know how those work, Lyrica and Neurontin. We just know that they do work. And then topical prescription pain creams. Interventional treatments may include trigger point injections, which are subcutaneous injections that can be excellent for relieving spasms in the back. Intradiscal injections can be good for degenerative disc disease, and that's when steroid medication goes into the disc, and studies have shown that can provide pain relief for a few months at a time. Epidural injections is actually what you see here. You have a disc herniation, pinching on a nerve root, and the steroid medication envelops and bathes this inflamed area and soothes it. It doesn't cure the problem, but it can be very helpful. Well, what are the outcomes of disc bulges and symptomatic disc herniations? Over 3/4 of those with degenerative disc and symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms due to either a pinched nerve or irritation from degenerative disc disease with an annular tear, over 95% of patients are able to avoid the need for surgery. This was looked at in a landmark study back in 2006, where the outcomes of disc herniations at 1 year are no different non-operatively than those that had surgery. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.